Good morning. My name is Tiffany Garcia, and I have been a student at Ashford University since 2017. I am currently working to complete my second master's degree in psychology. I also hold a master's degree in organizational management, which I earned at the University of Phoenix in 2009. I have a great interest in psychology and understanding more about helping children with mental health issues, as I am raising adopted special needs twins with multiple mental health issues. And I understand that mental health issues are increasing, and more people are seeking mental health services. So, learning more about psychology will be very useful. So here's my presentation, Children's Mental Health Matters. We're going to get started with the abstract. So mental health issues has been a subject that many people do not like to talk about, as there are not always clear treatment and programs available for mental health issues. It seems that mental health issues are significantly increasing, especially in children who are school aged, and they started experiencing serious mental health issues. There are many people and children seeking mental health treatment and services. Testing and making appropriate mental health diagnosis can be a complicated field of study. There are multiple processes involved that need to be followed in order to effectively treat patients. So we're going to keep going here. This is just an image of a child who may be struggling with mental health issues. There are the four domains that have been chosen to be further examined are learning and behavior, mental health concerns with children, and post-traumatic stress disorder, and diagnosing mental health issues. So it seems that mental health issues are significantly increasing, including children who are in public schools and start experiencing mental health issues at young ages. So as explained by Anderson and Cardoza, you might call it a silent epidemic. Up to 1 in 5 kids living in the U.S. is showing signs or symptoms of a mental health disorder in a given year. Learning disabilities are also increasing and are included in mental health services. According to Sinu and Natiya, learning disabilities are explained as problems in language, attention, perception, memory, auditory perception, language, visual perception, fine and gross motor coordination. They continue to explain it is estimated that about 15 to 20% of school-age children are reported to have learning disorders. So here's just a picture that's kind of emphasizing how big the needs are, or the struggle is, with mental health issues. Only 1 in 5 children will receive mental health treatment. So this is just going into a little bit more detail about learning and behavior. So it talks about behaviorism here. So mental health issues are concerning for children. And it's having a direct effect on our schools and communities. There's some more detailed information here. Next, we have another image of a child who may be struggling with some mental health issues and possibly doesn't know how to verbalize or get the help that they might need. Another common disorder that a lot of children and people are being diagnosed with is post-traumatic stress disorder. So this explains a little bit more about PTSD. And then another important piece of mental health is being able to diagnose mental health issues and forming a treatment team. So here we have some information about, primary care physicians and developing a team to treat mental health disorders. And then finally, we're going to talk about understanding mental health issues. So what is happening? Why that so many children are dealing with mental health issues? So according to Santiago et al., exposure to traumatic events is all too common, increasing the risk for significant mental health problems such as post-traumatic stress disorder and depression, and smoking. So there's other factors that are helping to cause mental health disorders, such as smoking and excessive alcohol consumption, impaired social and occupational functioning, and overall a lower quality of life. So we need to take action and, get some more processes and services set up to help with the mental health issues, especially when we're dealing with children. So hope you enjoyed the presentation. Thank you.